Thanks so much for having me. Feel like this has been built up, so I'm excited. I hope I live up to Colonel Page's expectations. I'm just going to show you a few charts. I'm really here to talk about a little bit about the status of what's going on with the vaccination efforts in Alexandria. And so want to kind of walk through that a little bit so that way we can get on the same page. All right, so this is already 2 days old, so we've already surpassed some of these numbers, but wanted to give you a current status report. You know, when we're looking at who is eligible in Alexandria right now, right at this very moment, it's every Alexandrian who is age 16 and older. And that population is about 133,000 people. And we're trying to hit a target of vaccinating 80% of that population. So that is about 106,000 people. And so far, we are just at about halfway there. So we've, well, a little bit over. So we vaccinated almost 50% of those residents, and almost a little over a third of those residents are fully vaccinated, meaning that they've gotten both of their shots if they have Pfizer, Moderna, or they've gotten one dose of the Johnson & Johnson. So we still have a long way to go. The other complicating factor, exciting factor, is that it's possible that any day now, we will hear that Pfizer will be authorized to give to people ages 12 to 15. So we're waiting on that authorization. We've already started planning with the schools about what that would look like to be able to support our younger Alexandrians. So we're very excited about that prospect and expanding the pool of who is eligible for vaccines. So kind of along those same lines, so, you know, I want to talk a little bit about what is currently available in Alexandria, because the landscape is so incredibly different right now than it was even the last time that I spoke to CCNA. So previously, we had a real supply issue. Supplies were extremely limited, and it was hard for a lot of people to find appointments. You know, you would have people sitting on the CVS website, hitting refresh at midnight, trying to get an appointment. That is not the case anymore. There is a ton of vaccine available. In fact, if you wanted to right now, I can tell you where to go get a Johnson & Johnson shot, like right this second. So if you know people, let me know and we'll send them over. So we have all three vaccines available in Alexandria: the Pfizer, the Moderna, the Johnson & Johnson. You know, whenever we're asked about, well, which vaccine is the best, which one should we get? Our answer is always the same. The best vaccine for you is the one you get first. And really, that's kind of the bottom line. We know that there are some people who have specific preferences, or, you know, they might have different allergies that, you know, might make one unavailable to them. And if that's the case, that's totally fine. There are a ton of available options across the city. So you can actually pick whichever one you want. And again, supply is no longer really an issue right now. And so it's all there. And in terms of where the vaccines are, so the health department has our clinics that we manage across the city. So we have two big locations, one at the old Pier 1 in Potomac Yard and one at GW Middle School. We're also working on several smaller locations that I'll talk a little bit more about in a minute. And then there's also a number of private providers that we work really closely with, where we provide them vaccine and they set up in different locations. So these are a few of the names of the different providers that are around Alexandria that are offering their own clinics and working with the community in that way. And then in addition, a lot of our pharmacies and grocery stores have vaccines. They have a lot of appointments available. So that includes Safeway, Harris Teeter, CVS, a number of availability. And I want to know about, like, well, where do you find all of these details? Well, we have most of them listed on alexandriava.gov/vaccines. And I wanted to show you all a little bit about what that looks like so that you can help people that you know navigate through this and be able to access this. So this is a screenshot from our website about what you might see on any given time. So we have the type of vaccine very clearly listed, as well as the age that goes with it, because we know that right now Pfizer is the only vaccine that is available for those under 18. So we want to be really crystal clear about what ages should attend what vaccine clinics. We have the day, the hours, the location and all of that. And you can see that these links are here, these schedule now links. So you can actually just click directly on it. There's no more pre-registration system. You can directly schedule an appointment, but we also have a number of vaccine availability that is just walk-in too. What we found recently is that there are a number of members of our community who really don't want to share a bunch of information up front, right? Like they would rather walk into a clinic and then be able to register and share that information versus booking an appointment ahead of time. So we want to really accommodate that and try to reduce any barriers that people are experiencing. So now walk-ins are welcome at a lot of locations. So I kind of was alluding to this a little bit, but I want to talk about how vaccination efforts are transitioning within the city. So previously, we had really been focused on these very large mass vaccination clinics where we could vaccinate almost 2,000 people at one day. But now we're really looking at, can we do more frequent, smaller clinics? So about 100 to 500 person events that are more neighborhood based and that might be a little bit more comfortable for people. And, we used to be able to moderate that with these pre-registration lists. So you all may have filled out the Virginia pre-registration form or a Maryland form or a DC form, and you would have to wait until we reached out to offer a vaccine appointment. But again, that is no longer the case. There are walk-in availability all the time. And you can actually find a lot of same day appointments too for people who maybe didn't know if they were able to get a babysitter that day or didn't know if they were working an extra shift that night and couldn't make things work. Now there's just a ton more flexibility for people to be able to pick the options that work best for them. And similarly, about that availability is that we used to just have those kind of a few spots around the city that had these big clinics. But now we're really looking at focusing even on a more hyper local level. So how can we have more of our mobile vaccine unit and these neighborhood based options? So we've been doing vaccines at the William Ramsey Recreation Center. We're going to the Charles Houston Recreation Center tomorrow night. We're actually doing our first kind of evening weekend clinic there, which is really exciting. We've been working with a number of churches to offer vaccines on their sites, as well as other locations. And we really appreciate those spots because they're trusted, they're familiar, people are more comfortable, they can walk there, they can use the bus to get there. It's just a lot better for accessibility. And then again, previously it used to be you had to really search and hunt for those vaccines on multiple websites, jumping around to do that, to be able to find a vaccine for those who are interested. That is no longer the case. And also, we're really lucky we received some FEMA funding from the federal government that we used to hire some public health outreach workers who are all bilingual in either Spanish or Amharic. And we have actually been doing a really extensive community outreach and canvassing effort. So we've been tabling outside of grocery stores and libraries and other locations, but we've actually also been going directly door to door in a lot of locations, primarily on our west end, as well as in our Landria. So we have been knocking on doors, leaving behind door hangers, booking appointments on the spot for people. And so far, it's been a fairly successful effort, and we're excited to keep doing it. We're using a really data-based approach in that we are focusing on the census tracts and the neighborhoods in the city that have higher poverty levels in our community. So focusing there first on where we're going to be knocking on doors and reaching people. So that means also going into a lot of apartment buildings, going door to door, working with the property managers to make that happen. So we're really excited to be able to do that and to be able to reach people. We're having a lot of really great conversations on the doors, where at first we might be talking to someone who is really not interested in a vaccine, but then after a few questions and kind of having a conversation, they end up having an appointment. And it's because we're using an approach of compassionate conversations. It's not, you have to get this vaccine, you must do this, otherwise you're terrible. It's really about listening to what the other person has to say, what their concerns are, and the facts that we can offer them to help address those concerns directly. And from what we're hearing from our outreach workers, it's that people really appreciate that approach, that we're not pressuring them to get vaccinated. It's more about having the conversation and keeping them informed about how it all works, which I think we're going to hear more from Dr. Moore about how to have those conversations, which is really, really important. Really quickly, I wanted to talk about the numbers in terms of who is getting vaccinated, because I know that the health inequities in our community are a really big focus for CCNA. And so I wanted to just touch on those numbers really quickly. So this chart here, you can see, let me make it a little bit bigger. So you can see the percentages of our population. So what is our population made of by ages? And then the blue bar is actually of all the vaccines that we've given, how do they break down by age group? And so as you can see here, our older adults have disproportionately been getting our vaccines, which is a good thing, right? Like that's actually a positive, like that's what we want to be seeing, because that was our major focus and continues to be a major focus, because we know that older adults are at higher risk of severe illness, hospitalization, and even death if they contract COVID-19. So our biggest focus for the first few months of vaccines, and continues to be, are older adults in Alexandria. Now, as we see, if Pfizer is authorized for a younger age group, we will likely see this 10 to 19 bar start to increase as well. And we know that, like, looking here is that we need to do more work to support our 20 to 29 age group, because that is actually also the age group that is predominantly responsible for a lot of new COVID infections, are those younger adults. So we want to make sure that we're supporting them and protecting them as well. And then the next slide I want to show is about the same kind of thing, but based on both race, ethnicity, as well as by sex. And so the first thing I want to draw your attention to is how many vaccinations are not reported when it comes to race and ethnicity, like almost half, which is a lot, which makes it really hard to look at the accuracy of this for sure. And so I want to kind of caveat that first, that limitation. But of what we do know, we can see kind of lining things up. So if we were living in a totally equitable, world, we would see that these red bars would be roughly equivalent to our to the gray bars of what our population looks like, but that is not the case. We see that, that predominantly a lot of the vaccinations have been going to our white residents, as well as we're seeing actually a lot of our Latino residents are getting a relatively high amount of vaccinations compared to the proportion in our population. And where we're seeing a real gap and a real challenge is on our Black or African American residents, which is what we really want to focus in on, and how do we support that community better. We also noted that there is a gap when it comes to male versus female vaccinations, and that females are actually getting vaccinated at a higher rate than males are. This isn't terribly surprising, because women tend to get more preventive health care and just more health care in general than men do, for a number of different reasons. There's a number of studies about this, but it's still concerning, and it still means that we need to do more to address this and be able to support men in our community. So we're looking into that as well, and would love your all's feedback. And really quickly, I want to touch on what are the results of all of this. So we've been doing all these vaccinations. So how does it show in our community? To just put it all in context, like, why are we doing all this? This time last year, our new infections were about 50 to 60 a day. Right now, a year later, with vaccinations, they're at about 14 cases a day or under, which is really phenomenal, and especially better than where we were in early January, that you can see before vaccines really became more mainstream. in that, we were hitting highs of about 150, 160 new cases per day, which is a tremendous amount of cases and suffering in our community. And then the last thing that I wanted to note that I'm sure Alan will touch on as well at some point, or Colonel Page, is that, we're doing all this work around COVID, but we actually have this kind of incredible opportunity right now with more funding coming in, with other supports, with everyone kind of looking and saying, like, they're finally realizing all the disparities that already existed in our community. COVID didn't create these disparities, it just highlighted them. So we have this amazing opportunity to really address some of those underlying causes, which make us more resilient for future pandemics and future issues. So right now, between the health department and the Partnership for a Healthier Alexandria and that steering committee, we are working on Alexandria's 5-year community health improvement plan with a focus on mental health, poverty, and housing. This has been a labor of love for the last few years, and it is just about to be released to the community, which we're really excited about because this is actually kind of a rare project in that the health department didn't build it, the partnership didn't build it. Like, this was really a community built plan with an incredibly amount of diverse stakeholders participating in this work. And you'll be able to see that reflected in the strategies and tactics. And a lot of them are these policy and systems changes. They're not just band-aids to slap on these issues. They're really getting to the heart of, the discriminatory issues that cause health disparities. And so that's what's really exciting. And we have this kind of rare opportunity right now to be able to make some lasting change beyond just the pandemic.